Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. The charge nurse for the shift is making shift assignments. Which of the following is a patient-related factor to consider when making staff assignments? Whether the assigned nurse is a float staff member, the nurse-to-patient ratio, required isolation precautions, the skill level of the RN. Patient-related factor when making staff assignments. Required isolation precautions. This is the only answer related to the patient out of the options list. The other options are staff related. Patients are assigned to nurses at the beginning of each shift so that nurses and other members of the healthcare team are aware of who is responsible for each patient. Making assignments requires consideration of both patient and staff related factors. Patient-related factors include whether isolation precautions are required, the clinical complexity of the patient, and any procedures scheduled on a particular shift. What is the definition of a critical pathway? Acting as a client advocate, guidelines that provide direction for optimal client care, nursing collaboration in which all members are treated equally, private information about a client that is shared by medical professionals. Critical pathways represent the guidelines that provide direction for optimal client care. They are centered on best practice guidelines and highlight important steps in the process of caring for a client with a specific condition so that nothing is. The parent of a 12-year-old who has been diagnosed with influenza type A demonstrates understanding of the benefits of the child taking Tamiflu with which of the following statements? Tamiflu will prevent my child from getting the flu. Tamiflu will help decrease the flu-like symptoms. My child needs Tamiflu to treat the bacterial infection. No, it's viral. Tamiflu will protect my child from getting pneumonia. Tamiflu helps decrease the flu symptoms and is most effective for influenza types A and B. Tamiflu is an antiviral that treats flu symptoms and is not effective against pneumonia. Now, Tamiflu is an antiviral, so it stops viral replication. So I guess if you want to overthink this in an indirect way, it prevents the child from getting even more sick. And there is viral pneumonia too. But the best answer was Tamiflu will help decrease the flu-like symptoms. The nurse is charting a skin assessment on the newly admitted client. The client has a flat and non-palpable discoloration on their leg that is less than 1 centimeter in size. The nurse should chart this using what terminology? A macule is a flat and non-palpable and less than 1 centimeter in size. That is just straight from a health assessment. It's a knowledge-based question. A 35-year-old pregnant client tells the nurse that she has been feeling significant stress in her life since she became pregnant. Select all of the appropriate measures the nurse can suggest as part of stress reduction in a pregnant client. And they were all right. So note that on some select all that apply answers, all may be correct. So don't just not pick it because you're like, oh, it's never all of them. Thank you so much for watching. Make sure that you hit the like button, make sure you subscribe, and make sure you turn on that notification bell. It helps other students find my channel, and I appreciate it tremendously. Have a great day.